Optimal NHS service delivery for the ongoing care of older people in care homes. A realist evaluation. More than 400,000 older people live in residential care in the UK, occupying 3 times the number of NHS hospital beds. More than 90% of care homes are privately owned, and 2 in 5 residents are now paying the full cost of their own care. Care home residents are typically over 85 years old, frail, and in the last years of life. Many have complex needs, including living with dementia. Only 1/3 of care homes are registered for nursing. The majority of care homes rely on the NHS for access to medical and specialist healthcare, but the NHS services they receive vary greatly. The aim of the Optimal study was to explore the features that support effective working between the NHS and care homes. We tracked the healthcare services received by 239 residents over a year and interviewed care home staff, visiting healthcare professionals, residents and family members. What needs to be in place to help care home residents access NHS services? Our first key finding was that shared aims should be agreed between care homes and the NHS. Findings suggest that establishing collaborative and equal relationships between care homes and the NHS is vital. Attention should be paid to having the right mix of people at meetings. Establishing shared policies and procedures and facilitating partnership working for mutual benefit.
There is such a lot of crossover and overlap in our work. It's really important to maintain close working relations with care homes so you can coordinate what's happening and to make sure that our plan fits with those of other health professionals.
Shared aims can help residents get the right person-centred care in the right place. Wherever possible, this should be in the care home. Key finding 2. Importance of NHS and care homes working together. The research highlighted that how NHS services work together with care home staff, residents and their relatives is important. Setting up collaborative ways of working takes time, and it may take several visits for the groups to achieve trust and mutual understanding of the challenges being faced. Valuing and respecting each other's views and expertise is key. This needs to be an ongoing relationship with regular meetings.
When I first came here in 2012, there was a very fractured relationship with district nurses. Then, as a new manager coming in, staff had had a lot of changes, new paperwork, new policies and procedures. It was a lot for them to take on board. And I think once the district nurses could see that the policies were working and things were improving in the home, that staff were having a say in their working environment, then things changed.
Joint working can help improve resident access to NHS services, avoid crises and improve satisfaction with healthcare provision in a more cost-effective way. Key finding 3. A joined-up approach across the whole system is needed. The NHS needs to respond to the identified needs of care homes and work together on behalf of the people who live, visit and work in care homes. For instance, a GP or specialist nurse may find it hard to make referrals work on their own and get the right service for a care home resident. Working together across services can result in better outcomes for residents and reduce demand on urgent and emergency services, decrease hospital admissions and length of stay, and improve medicines management.
Something that can be a problem is that homes don't always know who to contact or can't get anyone to respond. And because there's a need, they just say, I'm going to refer to everybody and see who comes fastest. Obviously, that's not the best approach because sometimes it creates delays elsewhere. That's somebody sitting on a waiting list for the wrong clinician.
Key finding 4. All NHS and care home staff need to have understanding of and access to expertise in dementia care. Training in dementia care, combined with access to dementia specialists when needed, are essential for all staff, both in the NHS and care homes, to deliver good person-centred care that promotes residents' well-being.
We need to get information from anybody that knows them, and then support the staff if somebody is presenting behaviour that challenges. Our support workers look at engagement and well-being, so they perhaps look at reminiscence or find out what their particular hobbies are. If there are mobility issues, we refer to physio, so there's quite a lot of work to do from that initial assessment.
What we learnt. Care homes play an important role in health and social care. They are caring for older people with very complex needs. Residents' access to healthcare is better if the NHS fosters positive relationships with care homes. We found examples of successful partnership working between the NHS and care homes. There is some great work going on, and we must keep learning from this. However, there is no one model of partnership working that works best. Going forward, we need to value and support activities that enhance relationships between care homes and the NHS. Care homes need to be viewed by the NHS as equal partners. Effective working relationships will lead to better outcomes for residents, relatives and staff. Working together can save money by sorting out some of the problems in the system that get in the way of good care being delivered. However, it takes time to learn how to work well together locally. In addition, both NHS and care home staff need support when providing dementia care. Partnership working with care homes is really important, as care homes are looking after some of the sickest and most vulnerable citizens in our society. Let's open up a dialogue today about how we can work better together to help residents access the healthcare they deserve and that we would want for ourselves if we were in their place.